Welcome back, viewers. This will definitely be the fifth video of our KROK1 on Pathmorph. And if you've not yet subscribed, do so. If you like the video, share it as well. And don't forget to click on the notification button or bell for any update. So, question 101. Autopsy of a 69-year-old woman with overweight who died of acute myocardial infarction has shown multiple whitish solid masses in the coronary intima. They bulge into the lumen and restrict it. Of course, arteriosclerosis. So what stage of arteriosclerosis is described? Alright, now before we get into the answer, there are 6 stages of arteriosclerosis. 1, we have the prelipid stage, which is characterized by mucoid swelling of the intima and accumulation of plasma proteins and the destruction of endothelium and elastic with collagen fibers of the intima. Stage 2 is the stage of fatty stripes or lipoidosis. This appears due to the lipid infiltration, lipoproteins, and proteins fixation. They appear histologically as xanthomic or foam cells. Stage 3 is the stage of liposclerosis. This is characterized by the secretion of cytokines and the growth factors by macrophages. Lipids therefore accumulate in both the macrophages and the muscle cells. There is also the formation of what we call fibrous cap. Stage 4 is the stage of arteriomatosis. This is characterized by necrosis of the central part of fibrous cap with the formation of amorphous substance called arterioma, hence the name arteriomatosis. Stage 5 is the stage of ulceration. This is characterized by the break of the fibrous cap cover and forming of ulcer with small hemorrhage into plaque. And the final stage is the stage of arteriocalcinosis. This is characterized by deposition of calcium in ulcerative plaque. Now, over here in the question, there is the formation of whitish solid mass in the coronary intima. This is what we call the fibrous cap. And fibrous cap is in what stage? It is in stage 3. That is liposclerosis. So your answer here is E. A histological examination of the aorta wall has shown a great amount of xanthome cells, mostly located in the intima. You remember? So, what are the following changes typical for? Of course, this is the second stage of arteriosclerosis. So, your answer is definitely C. A patient with hypertensive disease was diagnosed a long term of hypertensive crisis. Name the pathomorphological changes in arterial wall during the hypertensive crisis. Now, in hypertensive crisis, there is the combination of cell necrosis and deposition of plasma proteins in the vessel wall, and this is termed as fibrinoid necrosis. Hence, our answer is A. Okay. A 60-year-old man has been ill for essential hypertension for a long time and died of chronic renal insufficiency. Autopsy has shown that both kidneys were considerably decreased in size, Their surface was fine-grained. Histologically, the majority of glomeruli was hyalinized, a part of them sclerosized, and some of them hyperplastic. Stroma had the areas of necrosis, arterial, and arteriosclerosis. It lasts to whatever. Name the changes. Now, the main clinical morphological forms of essential hypertension, the main ones, include cardiac form, cerebral form, and renal form. Now, the renal form is characterized by chronic arteriosclerotic nephrosclerosis. It is characterized by chronic arteriosclerotic nephrosclerosis. That's the renal form. So our answer here is E. E. So this is renal form. So your answer is E. A 67-year-old patient had essential hypertension for 20 years and died of chronic renal insufficiency. How did the kidneys look at the autopsy? I've already explained this. So our answer is found in the previous questions. Therefore, the answer is what? Little solid with fine-grained surface. Little solid with fine-grained surface. D. Autopsy of a man who died of essential hypertension complications has shown small solid kidneys with fine-grained surface. So what is your answer? This? Now the question is name the kind of what? Kidney. Now this term, this is a term that is used to describe kidneys that have been what? Strengthened. So we call it primary strengthened kidneys. Primary strengthened kidneys. Therefore, our correct answer will be what? Contracted. To contract means to be what? To be strengthened. And this is the kidney. So your answer is B. Autopsy of a man who died of pulmonary edema has shown a big yellow-gray focus in the myocardium and a fresh thrombus in the coronaria. Specify the diagnosis. Now, anytime you see or you hear of blockage of artery of the heart, always think of what? Ischemia or infarction. Ischemia or infarction. Because this thrombus is blocking it. So what therefore is our answer? Our answer is what? Myocardial infarction. Myocardial infarction. Because it's happening in the what? In the myocardial muscles. Myocardium. A patient with myocardial infarction, has signs of blood circulation insufficiency. That's what cyanosis, cutaneous fat edema. After physical activity, what morphological changes develop in the place of myocardial infarction after recovery? After recovery, there will always be what? Sclerosis or scarring. So therefore, our answer is what? Cardiosclerosis. Cardiosclerosis. Autopsy of a dead 58-year-old man has shown a big gray pale focus of softened gray substance of papy consistency in the right temporal lobe. Numerous white-yellow thickenings of intima that sharply restrict the lumen have been detected in the arteries of the base of the brain. What is your diagnosis? Of course, don't forget, restriction of the lumen means what? Ischemia. And ischemia in this case will be what? Ischemic stroke. As simple as that. So your answer is B. Alright. Now, autopsy of a dead woman has shown morphological manifestation of the left atrioventricular aperture stenosis and mitral valve insufficiency. Historically, there was detected a focal sclerosis in half-curve cells. Now, what is the most possible diagnosis? Now, in rheumatism or rheumatic fever, just briefly, rheumatic fever are groups of collagen or systemic connective tissue diseases, which include rheumatic fever, rheumatoid arthritis, systemic lupus erythematosus, scleroderma, dermatomyositis, and so on and so forth. Now, due to the presence of these Ascoff cells or Ascoff bodies, it is easy to diagnose rheumatism or acute rheumatic fever. Acute rheumatic fever. So, our answer is rheumatism. 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 A histological examination of the mitral valve has shown a mucoid swelling, endothelium damage, and fibrin thrombi formation on the covering margin. What form of rheumatic endocarditis is observed? Now, this is what a polyp of endocarditis. This is an inflammation. That is A. And this is an inflammation with the formation of pedunculated masses of fibrin or thrombus attached to the ulcerated valve. There's a textbook in the description. Please, if you want to know more about all these terminologies or all these diseases, please find time to go through them. I am just here to guide you. So please read through them and you can get a better understanding. If there's any question, feel free to write to us and we'll be more than happy to help. So your answer is A. A pathomorphologic examination of a man who died of cardiac insufficiency has shown that mitral valves are deformed, thickened with joined margins. Nodules consisting of fibrinoid necrosis areas are diffusely scattered in the connective tissue. Macrophage macrophagocytes that look like giant multinuclear cells accumulate around these nodules. Lymphocyte and single plasma cells surround similar focus. What granuloma has been detected? What granuloma has been detected? Now, this describes the diffuse form of valvular endocarditis. Valvular endocarditis, according to the classification. Therefore, our answer is rheumatic fever. Rheumatic fever. Autopsy of a child who died of cardiac insufficiency has shown the dilated cavities of the heart ventricles. Microscopically, there were detected hyperemia, edema, and diffuse infiltrate of histiocytes, lymphocytes, neutrophils, and eosinophils in the myocardial stroma. What is the most possible diagnosis? Now, this can be diagnosed as rheumatic myocarditis because it affects the myocardial stroma. However, it is characterized by the presence of Ascoff bodies or granulomatosis, myocarditis. We have diffuse or local lymphohistiocytic infiltration or vasculitis. We also have parenchymal damage. Now, this should be diffuse intermediate exudative myocarditis because it is the same as diffuse or local lymphohistiocytic infiltration and vasculitis. So your answer here is B. B. If I'm too fast, please just rewind. That's why it's a video and play it again. 114. Autopsy of a 25-year-old man who died of uremia has shown enlarged mortal kidneys with hemorrhages focuses. Pathohistologically, there were detected hematoxylin corpuscles, glomerular capillary membranes in the form of wire loops, hyaline thrombi, fibrinoid necrosis focuses, and bulbous sclerosis in the renal vessels. What is the most possible diagnosis? Now, this we are talking about systemic lupus erythematosus. Why? Because it is characterized by different cellular and tissue changes, which can be divided into 5 groups. 5 groups. 1, we have acute necrotic and degenerative changes of the connective tissue. Secondly, we have subacute interstitial inflammation of all organs, including capillaries and vasculitis and arteriolitis. We also have changes of sclerotic character caused by the above changes. We also have changes of immune system. We have nuclear pathology, especially lymph node. Now, this whole description, look at it carefully, it is describing what? Atherosclerosis. Okay, so your answer should be good. E. Systemic lupus erythematosus. Please, if you want more, go through the description box. There's a textbook that can help you to understand better. Autopsy of a 40-year-old woman who died of uremia has shown enlarged with glomerular thickened capillary membranes in the form of wire loops, fibrinoid necrosis, blah 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 blah. Oh, this is also what? Systemic lupus. Systemic lupus. Okay, so the answer is D. D. Lupus nephritis. D. Autopsy of a dead 19-year-old woman has shown polypus endocarditis of all the valves, focal and subendocardiac hemorrhages, ulcerous stomatitis and esophagitis, pneumonia, nephritis, hyperplasia of spleen with perivascular sclerosis, vasculitis, and necrosis in the thalamus area, and numerous furuncles. What is the most possible disease? This is, again, systemic lupus erythematosus. I mentioned the description already in the previous question, so please go there for more info. After supercooling, a patient has joint deformation, joint painfulness, restriction of fingers movement, little solid nodules appeared around the joint. This is definitely talking about what? Rheumatoid arthritis. Rheumatoid arthritis. Rheumatoid arthritis. Okay. 118. A 45-year-old man fell ill with pneumonia. Now, pneumonia is an acute inflammation of the respiratory tract with deposition of intra-alveolar exudate. Good. On the 6th day of the disease, a pulmonary edema developed and caused death. Autopsy has shown that the upper part of the right lung is totally affected, enlarged solid with fibrinoid pleural thickening. It is of gray color on the cut. turbid fluid drains from the cut surface. Microscopically, in the alveolar lumen, there is fibrin, neutrophils, macrophages, lack of erythrocyte. What type of pneumonia did the patient have? All right, so there are some classification of pneumonia. We have lobar, actually there are three main. We have lobar pneumonia, which is also called Kryptos, fibrinous, or pneumonia. Pneumonia. This involves a lobe of the lung, usually the upper part, with the presence of fibrinous exudate in the alveoli. Okay, so already we know our answer. Yes, this is Kryptos. Now we also have bronchopneumonia or lobular pneumonia. This is marked by patchy exudation, consolidation of lung parenchyma. Interstitial pneumonia, that's the third one. This is marked by lobar or patchy areas of congestion without consolidation. So of course, our answer is Kryptos pneumonia. Autopsy of a 58-year-old man who used to have alcohol abuse, for a long time and died at home, has shown macroscopically the right lung is enlarged, its tissue is of grayish color, smooth, pleura is covered with grayish membranous layer. Microscopically, alveolar lumens contain fibrin fibers. Come on, what are you thinking? The answer is what? Lupus. Autopsy of a man who had malignant gastric carcinoma and died of cancerous intoxication has shown solid red-gray distorted focus that bulge above the cut surface of the low back part of the lungs. Microscopically, the exudates rich in neutrophils was detected in the lumen and the walls of small bronchi and alveoli. Name the disease. This is typical for what? Bronchopneumonia, but of purulent nature due to the appearance of red-gray mass. So your answer is acute purulent bronchopneumonia, D. Okay. (121). A histological examination of the bronchus wall biopsy material of a patient with chronic bronchitis has shown granulation tissue excrescences that rise above its surface and contain a diffuse inflammatory infiltration. What type of bronchitis does the patient have? Now, a mass that rises above its surface denotes polyps, and hence our answer is chronic polypus. That is E. A patient who had chronic obstructive pulmonary emphysema. Emphysema is enlargement of the alveoli. Died of pulmonary heart insufficiency. What changes can be detected in the heart? So as I said, emphysema is what? Overinflation of the alveoli. Now, pulmonary insufficiency is a condition in which there is a backflow of blood from the pulmonary artery to the right ventricle. Yes. Therefore, we are talking about right ventricular hypertrophy. Right ventricular hypertrophy. Because when the blood begins to move back, the ventricles in the right side will what? Become big or enlarge. So your answer is B. Since childhood, a patient had had chronic inflammatory pulmonary diseases. The sputum was scanty white, The patient was hospitalized with signs of pulmonary and cardiac insufficiency, which was the direct cause of death. What changes has the autopsy shown? Don't forget, the reason for the death was what? Cardiac insufficiency. So, what can we think? So then the autopsy will definitely show what? Hypertrophy of the right ventricle, just like in the previous one. So your answer is therefore E. Hypertrophy and dilatation of the right ventricle. A patient with bronchial asthma caught viral infection that provoked status asthmaticus with fatal outcome. Histological examination of the lungs has shown the spasm and edema of bronchioles. There was infiltrations with lymphocyte eosinophils. What? Come on, this is type 1. So the answer is B. Autopsy has shown that lungs are enlarged, pale, of soft consistence, not collapsed, and are cut with crunch. Microscopically, the widening of the alveolar path, the signs of intercapillary sclerosis and thick interalveolar membranes were detected. What pulmonary disease are these signs typical of? Of course, overinflation of the alveoli is called emphysema. Widening of the alveolar path. So your answer should be emphysema. The obstruction of the middle lobe bronchioles by a soft tissue node caused the atelectasis, that's collapse of the right lung middle lobe, collapse. A bronchobiopsy has shown the excretion of glandular epiphyseal epithelium with pathological mitosis that invade the underlying tissues and the cartilage. What disease do these signs indicate? Now, when they talk about a typical epithelium, it even means what? There's what? A tumor or what? Or cancer. Therefore, our answer is bronchogenic cancer of the lungs. Bronchogenic cancer of the lungs. So your answer is C. 27. Physical examination of the physis of a patient with angina has shown hyperemia of the mucous membrane of the palate. Enlarged red tonsils with small yellow pale focuses on their surface. What clinical pathological type of angina is the most possible? Alright. Now, patient is suffering from, of course, acute tonsillitis. And acute tonsillitis can be classified into the following. We have the catarrhal tonsillitis, which is characterized by hyperemia and serous or mucous leukocytic infiltration. We have fibrinous, which is characterized by the deposition of whitish yellow fibrous or fibrinoid films. We have purulent. This is characterized by phlegmonous inflammation or the formation of abscesses. We have follicular tonsillitis. This is characterized by hyperplasia of the tonsils. Leukocytic infiltration and necrosis of follicles also occur. Then we have Kryptos tonsillitis, also called lacuna. This is characterized by the deposition of serous mucus or purulent exudate located in scripts. Then we have necrotic tonsillitis, where ulceration occurs and can be in leukemia and scarlet fever. Then we have gangrenous tonsillitis. This is characterized by the presence of ulceration and hemorrhages. Now, the presence of yellow pale foci denote lacunar tonsillitis. So don't confuse it. It's what? Purulent tonsillitis. Don't confuse it with purulent tonsillitis because of the presence of pus. So your answer is D. D. Lacunar. Also known as what? Kryptos. Don't forget. 128. A vermiform appendix is 9 centimeters long and 0.9 centimeters thick. Serous membrana is dark and plethoric. Microscopically, the wall is edematous, stasis, and small hemorrhages in capillaries and venules. Necrosis focus surrounded by leukocytic infiltration are located in mucous and submucous membrane. What is the most possible diagnosis? Now, inflammation of the vermiform appendix is called appendicitis. Now, its acute form is classified into the following. We have 1, simple. Now, this is characterized by hyperemia and small hemorrhages. We also have what? Superficial. Superficial form is characterized by focus of suppurative inflammation in mucosa and edema. Serous membrane is dim, that is, it is dark. Then we have the destructive form. Now the description best fits acute superficial appendicitis. 129. A vermiform appendix sent to pathomorphologic department after the operation is thickened and enlarged. Serous membrane is dark and plethoric. Dark. Yellow-green fluid excrete from the cut. The wall is diffusely infiltrated with leukocyte. In case of what type of appendicitis do the changes develop? Okay, right now, one of the forms of destructive acute appendicitis is phlegmonous appendicitis, which is characterized by diffuse infiltration of leukocytes in the wall of appendix. And the appendix is therefore increased, swollen, tense, and markedly congested and covered by fibrinoid exudate. Now the clue here is that the wall is diffusely infiltrated with leukocyte. Therefore, our answer is phlegmonous. A microscopic examination of the vermiform appendix that had been operatively removed has shown edema, diffuse neutrophilic infiltration of the wall with necrosis, and the presence of mucous membrane defect with the affection of its muscle plate. What form of appendicitis has developed? Now, the other forms of destructive acute appendicitis, which include ulcerophlegmonous, which is characterized by phlegmonous inflammation with necrosis and ulceration in the mucosa. We also have apostematos. This has a formation of small abscesses. Then we have gangrenous, when there's large areas of necrosis. Now in this case, our best bet will be ulcerophlegmonous. So the answer is A. All these I'm talking about, you can find them in the description box. There's a book that I've put there to help you to understand. Morphological examination of a stomach has shown a deep defect of the wall with the affection of muscular tonic. The proximal margin is stab and the distal one is flat. Microscopically, an area of necrosis is detected at the bottom of the defect. Granulation granulation tissue and a massive area of healing tissue are in the muscle layer. Diagnose the disease. Now, the presence of necrosis indicates what? Chronic ulcer. And with its granulation, it means this is becoming what? Worse. It's becoming worse. So, our best answer is what? Chronic ulcer at the exacerbation stage. Exacerbation stage. 32. Autopsy of a dead 29-year-old man who had had duodenal ulcer for a long time has shown the signs of peritonitis, numerous steatonecrosis of the retroperitoneal fat, and pancreas. In the area of pancreas body, an ulcer-like defect is located, the margins of which contain necrotic masses. Diagnose this complication. Now, this is of course complication of duodenal ulcer, but it is of ulcerative destructive form. Ulcerative destructive form. Now, which include perforation. Now, perforation is that when the anterior wall ulcers penetrate into the free peritoneal cavity, resulting in peritonitis. Whereas penetration, whereby perforating posterior ulcer more often penetrate the pancreas, producing intractable pain. When it occurs in the lesser peritoneal sac, it is called localized peritonitis. That means you're talking about this guy. Then hemorrhage, usually of a coffee ground, vomit. So the presence of ulceration of the cancer means penetration has occurred. Penetration has occurred. So your answer is E. During the palliative operation of a 46-year-old woman with stomach cancer, Gruenberg's tumor has been detected. Now, Gruenberg's tumor is simply a tumor which refers to a malignancy in the ovary that metastasizes from a primary site and spreads via the lymphatic system against the lymphatic valve. Therefore, it is retrograde. So in this case, we have what? Lymphogenous what? Retrograde. So your answer is A. 34. Autopsy of a dead 42-year-old woman who had an operation on the stomach tumor has shown sharply enlarged white ovary of solid consistency. Histologically, there was detected atypical epithelial cells located between the layers and lesions bars of the connective tissue. What is the most possible disease? Of course, we're talking about what? Gruenberg's carcinoma. So this is B. Left subclavicular lymph nodes of a 45-year-old patient are enlarged. A metastasis of signet ring cell carcinoma. Now, signet ring cell carcinoma is a cancer that produces what? Mucin. Mucin was detected in the material. Choose the most possible localization of the primary tumor. Now, it is most often found in the glandular cells of the stomach and less frequently in the breast, gallbladder, urinary bladder, or the pancreas. So your answer is gastric carcinoma. So D is your answer. D is your answer. 136. A histological examination of a dead man who had received numerous drug injections has shown a hydropic hepatocyte dystrophy, Luxtaller's classy hepatocyte, acidophilic Gaussian corpuscles, and lymphocytic macrophagocytic agglomeration in the portal tracts. What is the most possible etiology of the disease? Now, from the anamnesis, the patient can be diagnosed with liver cirrhosis. Liver cirrhosis. And possible cause are viruses, genetic deficiencies, prolonged obstruction of the bile flow, long period exposure to drugs, and other toxic substances. However, the main culprit here is alcohol. So the best answer here is viral. Viral. A patient with chronic viral hepatitis died of acute posthemorrhagic anemia caused by the hemorrhage from varicose esophagus veins. Autopsy has shown a sharply diminished liver of solid consistency. A surface is microtuberous, microscopically thin-looped net of connective tissue, and small false lobes name the morphogenetic type of cirrhosis. Now, types of cirrhosis include post-necrotic cirrhosis. This is characterized by necrosis involving the whole lobes, leading to what? To scars. We also have portal or septical cirrhosis. This is associated with loss of lobular architecture forming fibrosis or scarring. Loss. Then we also have what? Mixed, of course, combination of the two. So with the false lobes, it means that there's a loss of lobular architecture. Therefore, our best bet will be portal or septical. So your answer is B. 38. Autopsy of a dead man who had had alcohol abuse. For a long time has shown a small solid microtuberous liver. Microscopically, false lobes are small and separated by a thin layer of connective tissues with blah 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 blah. So what is the stage? Of course, alcoholic cirrhosis. Always cirrhosis is accompanied with what? Alcohol, most of the time. So 139. Kidneys pathology. Autopsy has shown that kidneys are enlarged. Cortex white, yellow-gray with red impregnation, well separated from the moray marrow. Histological examination detected the excrescence of nephrolithium and podocyte in the glomerulus capsule with crescent formation. Phenomenon of sclerosis and cyanosis of glomerular stroma fibrosis. What disease is meant? Okay. Wow. Now, interstitial nephritis is a form of nephritis affecting the interstitium of the kidney surrounding the tubules. Glomerulonephritis, however, can be classified into the following. We have intra and extracapillary glomerulonephritis. That's according to topography. And according to the character of inflammation, we have non-suppurative exudation and we have proliferative. According to the method of propagation, we have diffuse and we have local. So we combine. So intracapillary proliferative glomerulonephritis is typical for post-streptococcal glomerulonephritis, whereas extracapillary proliferative glomerulonephritis is typical for rapidly progressive, in other words, crescentic glomerulonephritis due to the formation of what? Crescents in the Bowman's capsule. So this question can be diagnosed as rapidly progressive glomerulonephritis. Hence, our answer is E. Extracapillary productive glomerulonephritis. For more, just look into the description and get the book for yourself. Microscopical examination of the kidneys has shown the proliferation of nephrolytic in Bowman's capsule of podocyte and macrophages with formation of crescent structures, that compress the glomerule. Capillaries of glomeruli are necrotizing. Their lumens, fibrinoids, dystrophy of the podocyte. Name the renal pathology. Name the renal pathology. Obviously, this is what? Rapidly progressive glomerulonephritis. And this syndrome may occur in the course of 3 broad disease categories. 3 of them: post-infectious, rapidly progressive glomerulonephritis. Secondly, systemic diseases like systemic lupus erythematosus, like Goodpasture syndrome, and so forth. And then thirdly, we have what? Idiopathic, that is of known origin. Therefore, our answer is actually supposed to be post-infectious glomerulonephritis. That is B. However, they say the answer is A. I don't know why, but we'll go by it. But I would have gone for post-infectious glomerulonephritis. 41. A 36-year-old woman died of renal insufficiency. Microscopically, examination detected the proliferation of the capsule nephrothelium, podocyte, and macrophages with crescent formation. Crescent formation. Capillary lobe necrosis with atrophy. What is the most possible diagnosis? Now, acute glomerulonephritis is characterized by acute proliferative, and it is an important component of crescent glomerulonephritis. Hence, our answer is membranous nephropathy. Membranous nephropathy. So it's A. 42. Autopsy has shown enlarged kidneys with coarse tubular surface caused by the presence of numerous cavities with smooth walls filled with transparent fluid. What is your answer? Cavities. So think of what? Cystic disease. Answer is A. 43. Autopsy of a man who died of burn disease has shown cerebral edema, enlargement of liver and kidneys, cortex which is white and gray pale, but medullary substance is plethoric. Microscopically, the necrosis of tubules of the main department with what? With distraction of the basal membranes, edema of the interstitium with leukocytic infiltration and hemorrhages. What is the most possible diagnosis? Now, this condition can be diagnosed as acute tubular necrosis, or necrotic nephrosis. This is characterized by the destruction of renal tubular epithelial cells, either from ischemia, that is like shock, post-traumatic, or burns, or even dehydration, or nephrotoxins. Now, this question, it was caused by what? Burn. Therefore, our answer is B, necrotic nephrosis. 144. A 42-year-old man with a complicated form of typhoid had acute renal insufficiency developed which caused his death. Autopsy has shown enlarged erythematosus kidney. Fibrous capsule can be easily removed. On the cast surface, the cortex is grayish, pyramids are detect the marrow lumen of most tubules, enlarged epithelial cells without nuclei. collapsed glomerular edematous trauma with small leukocytic infiltration and small hemorrhages. What pathology are we talking about? It's the same guy talking about what? Necronephrosis. Necro, same as previous. Necronephrosis. 45. Patient with signs of mercury poisoning has the following processes in kidneys: focal necrotic changes in the tubules, the main department, necrotic infiltration, and hemorrhages in the interstitium, and venous congestion. What condition has developed? This is acute necrotic nephrosis. Acute necrotic nephrosis. Poisoning. Wow. 46. In the renal biopsy material sclerosis, lymphoplasmocytic infiltration of renal pelvis and calyces, dystrophy, and atrophy of the tubules were detected. Preserved tubules were widened, stretching by colloid-like masses. The epithelium was flat, that's thyroid kidney. What is the most possible diagnosis? Now, a renal disorder affecting the tubules, interstitium, and renal pelvis is called pyelonephritis. Pyelonephritis. Now, the hallmark of acute pyelonephritis are patchy interstitium suppurative inflammation and tubular necrosis. Whereas chronic pyelonephritis is a chronic tubulointerstitial renal disorder in which chronic tubulointerstitial inflammation and renal scarring are associated with pathologic involvement of the calyx and the pelvis. Now, sclerosis here means scarring. Therefore, your answer should be chronic. Chronic. Acute, scarring now. So the answer is D. 47. Autopsy of a woman who died of renal insufficiency has shown unevenly reduced in size kidneys with coarse tuberous surface on the cat surface, healing tissue alternate with unchanged parenchyma, renal pelvis, widened, thickened walls, microscopically. Come on, this is chronic pyelonephritis. C is your answer. 48. Morphological examination of a removed kidney has detected in the proximal part of the ureter the presence of concrement that obstructed its lumen, that's like a stone. The kidney is sharply enlarged with parenchymal atrophy. Renal pelvis and calyces are considerably widened. Microscopically, there is diffuse sclerosis, atrophy of glomerular and tubules. Preserved tubules are cystically widened. What complication? We are talking about what? Hydronephrosis. Now, hydronephrosis is a term that is used for dilation of the renal pelvis and the calyx due to the partial or intermittent obstruction of the outflow of urine. Therefore, this liquid accumulates. So, hydro, then of course, nephrosis. 49. Kidneys of a patient who died of chronic renal insufficiency caused by chronic glomerulonephritis are reduced in size, of solid consistence. The capsule can be hardly removed, exposing granular surface. On the cat surface, cortex and the medulla are thin. Renal tissue is dry, anemic, gray. How can we term such kidney? Come on, the thickening and the hardening of walls of arteries is called what? Sclerosis. So we have what? Arterial sclerosis. Arterial sclerosis. So your answer here is C. All right. Last question for this part. Yep. A patient with diabetes mellitus died of chronic renal insufficiency with uremia development. Autopsy has shown all signs of uremia with changes in kidneys. What microscopical changes do the kidneys have? Now, one of the complications of diabetes mellitus is renal failure. And this is due to what? Hydronesis and sclerosis of the glomerular capillaries. So your best answer is D. Alright guys, it's been a long day. And again, if you like this video or this information is very informative for you, like, subscribe, share, and click on the notification bell so you'll be updated. Tell a friend to tell a friend. Alright, I'm out. Enjoy.